the next panel is really where we first started using the term vital living, and worked with the Dominican Sisters of Hope 10 years ago. 10 years ago. So what was ironic, whoever said they would like to interview Mary Oliver, who was, okay, Mary Ann. So we used, the Dominicans had been at the time looking at doing a collaborative retirement center, and what would they do on aging. And then that didn't go that far, and so, because geography matters, and people were not in New York don't cross bridges, let alone state lines. And so then the Dominican Sisters of Hope realized that maintaining their own infirmary and all that, it was just prohibitive, and that they wanted to do something. So Liz had been hired like the year before, and was the administrator. I will tell you, I never, ever in my life imagined that she would go on this transformational journey and what she's created. But we used the Mary Oliver quote at a congregational meeting early on of, what do you want to do with your wild and precious life? And the sisters all had like little index cards with that printed on it, and then they wrote whatever they wanted. Well, they were, had been 10 years, probably at least, where they were Hope, but really it was Fall River, New Jersey, New York, Ossining, and then, yeah. And so, but when we looked at their numbers, they had about a third of their sisters in New York, a third in New Jersey, and then a third scattered all over. So we get this, what do you want to do? And like all these New Jersey sisters wrote, live on the shore. So, it was like, okay. Well, I can tell you that Sylvia was one of the pioneers who first went. She lives on the shore and right on the ocean, and she has that water view every day. So because they've been doing this, the Vital Living, so long, and what they've done with their program and the outcomes is really why we are so thrilled to have them be able to share their story and how resourceful and creative they've been. And Ronnie, how long have you been with the sisters? Long, almost since yeah. So I will turn it over to them.
Thank you. Thank you, everyone. Hopefully we can keep your attention since we have the prime time after lunch spot. Okay, so thank you, Robin. As Robin said, I was hired by the Dominican Sisters of Hope 11 years ago this month. And I was hired as their administrator of their infirmary. I am a licensed nursing home administrator, even though it was not a licensed facility. And then a year later, we started this process, and we had sisters eventually move to multiple facilities. And all of a sudden, we were like, how are we supporting them now in multiple spots? So in the summer of 2009, I developed a model and presented it to our leadership team, and that has become our holistic healthcare vital living team, and Ronnie's one of our coordinators that work with us. So I'm going to let Sister Sylvia just tell you a little bit about herself, and then we'll start the presentation.
I've been a Dominican sister for 70 years, and of that 70 years, 34, which I was residing in Newburgh, New York, at our mother house at the time, and teaching at Mount St. Mary College in the art department. And now I'm retired, and under the influence of Robin, she said, look for an apartment with a window in the kitchen. And that was at Asbury Tower, and that's where I chose to live. At first I thought I would want a cottage, but then that meant I didn't want to live as a monk, and I didn't want to be away from the others, so I chose an apartment instead. And we'll tell you more later.
Okay. And I'm not very good at sitting, so I'm going to get up to do my part anyway. So, okay, Gwen, we're good. We can go to the next and the next. Okay, in the beginning. So in 2007, when I started working in the infirmary, it was a traditional infirmary model. We had 50 plus beds, but we probably only had about 35 sisters utilizing 4 floors. So 4 floors of staff, nurses, aides, yeah, with very few sisters. And then on the other side of our mother house was the retired sisters who were still, and I put quote independent, because many of them did have some needs that weren't really being addressed at that time. They were living in small communities, but with a larger number of about 40 sisters. At that time, our congregation had 250 sisters. And I think Robin had touched on this earlier. There was definitely that view of the building was split in half. And there was that invisible line there where the sisters who were on the retired side, unless they were coming to the infirmary to complain about something, they did not want to cross the line. I think it was very fearful. They were afraid of just seeing the sisters aging and, oh my, it's going to be me sooner or later. So right away I went in there thinking that's not a good thing, and we started working on that. I kind of crossed over the line, invited the sisters in the small communities to have meetings with us. I would go over and just do topics on healthcare proxies, things that weren't like too threatening to them. So that's kind of how it all started. Okay. Then in the next year, we did begin the process working with Realm of closing our mother house and moving the sisters into multiple facilities and in long-term care communities. By February of 2009, the first group of our sisters, called the Pioneers, moved to the Wartburg Adult Care Community into Meadowview Assisted Living, where we still currently have 35 plus sisters on campus there. That is the community where the largest number of our sisters live. In November of that same year, the last sister moved out, and the following year we did sell the mother house to Mount St. Mary College, which is where we were located. We still have use, though, of the chapel and the cemetery and so forth. So, as I said earlier, we now have sisters in facilities in 3 states. And we're like, oh no, now what do we do? So I presented the model to our leadership team at that time. And basically, it's a care coordination model. We have independent care coordinators in 3 states. We have our community health nurse, who's actually one of our sisters, and she was in that role prior to the infirmary closing. That's Sister Anne-Marie. Myself as the administrator, and then we have Sister Sharon, who is our transition coordinator, who really helped us and continues to help us with all of our moves and the sisters transitioning. And I have slides just about Sister Sharon at the end, because it's a very important role. So our model back then was to provide support to our sisters as they transitioned into their new homes. Advocacy, we still were making sure that their healthcare needs were being met in the facilities, attended care plan meetings, hospital visits, ER visits, transportation to appointments. Soon, I began thinking, wow, it's not just the 40 so sisters that were in facilities. We still had a lot of sisters living out and about. So we developed an in-home assessment process, starting with the sisters that we felt were most at risk, that maybe didn't come to our community chapter meetings or congregation events. And sisters that we had heard through the grapevine, maybe were having some issues. So we did a pilot program first with sisters that I asked that I knew would be willing to be the guinea pigs. And once we went through that and we got a favorable response, word travels, we started with the next group of sisters. So we went from them, and then we started going by age. The sisters in their 90s, 80s. We got to the 70s, and then we kind of ended it there at that point. But the importance of that was really to start being proactive in the care of the sisters. We needed to know a baseline. We wanted to address any immediate needs that they might have, even as far as like putting shower bars in the bathroom or getting handheld, shower head, shower chairs, things like that. Putting medical alert systems, if they were willing to use that. And just so we would have an idea, if anything were to arise, we would be prepared. So fast forward to now. Right now we have 144 sisters. So we lost about 100 in the last 10 years. Our average age is 81, and 90 of our sisters are over 80 years old. Our oldest is 101 years old. Right now, our holistic healthcare team, we've actually increased hours and increased coordinators in the last 10 years. As you can see, we have coordinators still in all 3 states. We added another RN to work with the sisters who are living independently still up in the Newburgh area. Sister Sharon, who was our transition coordinator, went from part-time to full-time. And we still utilize sisters to volunteer as much as possible. However, they are aging. So one of our challenges now is covering emergency room visits and when the sisters have to go to the hospital, because they have been a wonderful help to us in being able to do that, but it's getting more difficult. Now, we continue to support the sisters where they are. They are currently in 9 facilities. We support the other sisters who are living independently in 11 states. We still do doctor's appointments, transportation, care planning, the hospital visits, coordination of services, moves. See the bold letters? Because there's lots of that. We provide transportation to retreats or help them set up in-home retreats. We make sure that they get on home visits, go on vacation, ongoing assessments, and whatever else is necessary. So my role as the administrator of the program is the coordination of the entire team. I work with all the facilities. I am their first contact if there is an issue with the sister. I work with the sisters on transitioning to different levels of care and then do all of the necessary paperwork to do that. Work with our finance department, so oversee budgets, assist with funeral planning, not my favorite job, and communicate with leadership. I report directly to one of the sisters on our leadership team, which is now my 3rd sister, soon to be 4th. And all of our team members play a role in play the pastoral role with our sisters. We've tried many different ways to provide that, from trying to just get a person dedicated doing pastoral care on our team to having a pool of sisters that are willing to do that. So we vary it as the needs change. Any questions on any of that? Yes.
What part of your team helps to organize the transportation to various doctors, etc.?
Each of our coordinators will do that for the sisters that they work with, but I'm very involved. A new role in the last couple of years is I'm actually on our driving committee and develop the testing program that we do for the sisters. So in that case, if a sister's no longer able to drive, we work with like taxi companies and so forth to set up transportation, or there's different things that we've done, but like Ronnie works with the sisters, to do that. Yes.
You said there are 9 facilities. Is it both assisted and skilled?
Yes.
Could
you say a little more about the assessments of the sisters that live independently? You talked about getting a baseline, addressing immediate needs. Beyond that, what else is included?
So I have we all have forms, of course. So it's a form that I developed that basically looked at their physical environment to make sure that it's a safe living situation and accessible and so forth. And then the other part of it then was really a health and wellness assessment. And another part, we actually use a wellness scale that assesses, that's a self-assessment part. So we really rely on the sisters to take care of that. We don't want to be intrusive, but it allows them to assess how well they're doing in body, mind, and spirit. And then if they feel like talking about that, we can take that a step further and develop a wellness plan for them. But the in-home assessment is really, someone said earlier, we have the form and we're looking for specific things, but you find out much more just in the conversation with them and by observing. So it's really a way for us to get in. And then part of our driving testing that we built, our program, was actually a health questionnaire, an interview. And I told the girls, because my team actually did those interviews, I said, don't really pay attention too much to what they're telling you. I want you to observe, what's going on with them and so forth. So it was another way to reassess them by doing the driving. So, okay, so how did we get where we are? As we've said, it's been 10 years since we started this model and this program. First and foremost, it's building relationships and building trust with our sisters. Secondly, we have confidence and support from our leadership team and mutual respect with the management and staff of the facilities that we do use. And then, of course, we have committed team members and our coordinators who, as Ronnie said, they've been with us from the beginning, which has been wonderful. Okay. So a little bit about relationship and trust building. As I said earlier, right from the get-go, when I started at the infirmary, I crossed that line and started working with the sisters on the other side and just did small group meetings and so forth. A lot of times it was just listening to their concerns and getting input on them on what they thought was important for their sisters, never about them, but the sisters that were in the infirmary. And then, as we started the model, I started attending our annual assemblies and community chapters, not all the time, but if there was a relevant topic. So I would do presentations, or sometimes it was a video presentation. And not always about healthcare. It might just be about a health issue or about healthcare proxies, advanced directives, yes.
Can you give an example of the kinds of presentations and videos?
Sure. So initially, one of the videos that I did was just about advanced directives. So when the sisters did their extended leadership meeting first, I presented it to them there, but then each of the community chapter leaders, coordinators, then took the video. They each had a copy. And then they presented it to the sisters. So it was informational, but more so it was so people got to know who we were. It was always multifaceted there. And then the presentations at the assemblies, the one year I did the presentation on the in-home assessment process and the wellness tool. I recently gave an update about all of the facilities that are options to the sisters and about aging in place, that word, which is all over my slides, by the way, aging in place safely and knowing when maybe, it's time to move on to the next level. We do newsletters on a monthly basis, and I thought about changing it to every other month or quarterly, but the feedback that we get from the sisters is incredible. And there's always an article about physical health, mental health, and spiritual health every month, and then a note from me. And it's really the sisters that are still in full-time ministry, the younger sisters, that really love the newsletter. So it's a way of connecting with them. So that's been good. We've done, we traveled a couple of years ago, took a presentation on the road, and went up to Plattsburgh, New York, and over in Massachusetts, and various places through New Jersey and New York, just to meet with the smaller groups. And I mentioned earlier the pilot program that we had done first to start going into the sisters' homes. And as you know, the sisters talk. So we purposely asked sisters that we had some relationships with that we knew were very positive and well respected in our community to try it out with first. And word traveled. And then more of the sisters were willing to let us come in. And as far as our independent care coordinators, we thought it was very important for the sisters to have input on who was going to work with them. So at each of the locations where we contracted with our coordinators, I had a group of sisters doing the interviewing with me. So that worked out very well to let them pick. And then, we assist with non-healthcare related items, transportation to home visits, like I was saying, getting them on retreat, running errands, just to help build that relationship with them. Okay. Next, leadership. I often go to meetings with other healthcare coordinators, that are working for the sisters, and a lot of them still feel that they're not respected or taken seriously, or that the sisters just don't want to give up that, that control over the healthcare piece, and it makes their job very important. Difficult. The important part for me was that I didn't have that. The Dominican Sisters of Hope, I think, were already ahead of the game in that many of our departments were already overseen by lay people. So healthcare, just kind of fell into that. They already had that mentality. Another big thing, you wouldn't believe it, but it actually made a really big difference, is they finally let me on their listserv. Whenever we had a sister, hospitalized or not doing well, I would always have to track down either my leadership contact person or Sister Anne-Marie that worked with me to put out an email to the sisters about what was going on with one of the other sisters. So this team has allowed myself and all of the department heads and actually key personnel to be on their listserv and email. And it's helped tremendously. Sisters that I don't see all the time write, they send emails, they ask questions. So that's been a big help. And then, of course, there's always open communication, ongoing dialogue with our leadership team and the council connectors. That's the thing I wanted to say about that. This team that leadership team I work with now, I do have one sister that I report to, but I work with every sister on the leadership team. Whoever the sister, whoever, say, Sister Sylvia's council connector is, if she was having some difficulty, I would go directly to her, to that council connector. And that's been great. It cuts out the middleman there. Mutual respect with partners. Not that it's necessary for someone in my role to have a administrator's license, but I think it's been very beneficial for what I do, because when interacting with our partners, and they truly are partners from day one, the staff and the administrators at the Wartburg and at Asbury Towers, we entered those relationships with them as partners. So we are visible. The girls are visible. We have open dialogue. We have regular meetings with them. I mean, they think that we're part of their staff, which is wonderful. But we also have respect from the administrators. And it's helpful because they might say in a nursing home, oh, I can't do that or whatever. Well, you know what, guess what? They know I know the regulations. So yeah, you can do that. You know, it has helped with my advocacy as well. And if, as I said, we now have 9 facilities. At one point we had 12 where our sisters are. If we ever start working with other facilities, which we've had, it's not as extensive as a process as when we worked with Robin and Realm, but we still have a process, you know, where we go and meet with them, and the leadership team comes and meet with them, and we tell them what's expected. So that's important. Okay. And our commitment from our care coordinators. Again, the original coordinators have been with us since very early 2010. It might have been December 2009. And then we added the other nurse, 2013. The sisters, I believe, truly trust them. They definitely tell them things that they do not tell their other sisters. And it's been good. And I think Sister Sylvia will talk about that in a little bit as well. Yes?
In the last slide, the care coordinators, all nurses,
No.
social workers?
All different. So Ronnie's a social worker. Sister Anne Marie, Sarah they are registered nurses. The one in Massachusetts is a social worker, and the one at the Wartburg is actually a physical therapist. When we advertised, we asked for someone more with the care coordination experience, not necessarily a nurse. But Sarah, who works with the independent sisters, we felt she needed the assessment to have the assessment skill background because the sisters are living in the community. So she needed that extra piece. But the others, I mean, they're working with sisters in facilities who have a full team of professionals working with them. So, you know, we should be able to call on them. Okay. So aging in place, or now what are we calling aging in the right place? And vital living. These are our current statistics. 144 sisters. Only 35 live in assisted living, and 9 live in a nursing home. And that's actually a high number for us with the nursing home, but of course, based on our age and the number of sisters in their 90s, you know, that's evolved. 100 live out and about in senior apartments, non-senior apartments, homes, and convents. We have 2 locations where there are clusters of 9 or more sisters living in, you know, like in an apartment building, such as Asbury Tower. 3 locations where 4 sisters live together, and the rest live either alone or with one other person. And earlier, someone mentioned, this just like a tidbit, we have a 93-year-old sister that lives in her family home and takes care of her 2 older sisters. One recently passed away, so there's one left, but she has a lot of support brought into the house, and we have connections with that support, so we actually get to keep an eye on the whole, on the whole thing, so. So the definition of aging in place is a conscious decision to remain in the setting of her choice as long as she can, with comforts that are important to her. This is the important part, right? As long as it does not jeopardize her safety and well-being, and it does not impact the common good of the congregation. That is always the difficult part. We may all feel that it's not good for the common good that one of our sisters live where they are, but you know, it's a process. It's a process to get them to transition to be where they need to be. Okay, so what has made it successful for us, for all these sisters that are all over the place in all these states, 11 states? Again, I already mentioned this with the assessment process. You need an appropriate physical environment. I mean, I must say, I think all of our sisters are placed where, you know, it's one floor, it's accessible, or there's an elevator, there's ramps, there's easy parking. So we really worked on that a lot. Location, location, location. Luckily, we really are not in any rural, out of the air, areas. We really have a lot of services close by, stores, church, healthcare, appropriate healthcare, especially at the shore. So we do look for that. It's been successful because the sisters really do form relationships with the people that live in their buildings. Some have family that are close by. It's very important for them to stay engaged in that way. They have access to services that our care coordinators help with: housekeeping, laundry, shopping, home health aides, transportation. Sister Sylvia is going to talk a little bit more about the social opportunities, but that's very important. Our sisters that live in the clusters, they make it a point that on Tuesday nights they meet for evening prayer. It's very important to them. We help set up spiritual opportunities with them. Like I said, if they can't get a ride to a retreat or need help signing up and so forth, we help them with that. And it's very important for them to stay connected with the congregation. I'm sure many of you are doing that as well with technology. Not everyone can physically come to our meetings, but we do Zoom conferencing, and now we're doing live streaming for some of our events. Even the funerals we live stream so that they can feel like they're a part of it. I think it's important for the sisters, when you are aging in place, to know yourself and know your limitations, and hopefully know when it's, when you need help and maybe can't be there anymore. Any questions on that part? Okay. So how our team makes it work. Obviously, the stability and the longevity of our care coordinators and the relationships and trust that they have built with the sisters. We really, because of that, we're proactive, and the sisters are proactive with getting regular checkups and making sure they have their immunizations. Yes, we have some that still don't, they do not want to set foot in a doctor's office, but really most of them definitely ask for help and seek medical attention probably earlier than they would have back when, Again, our coordinators help link for services. One thing that we've been doing a lot of is applying now for the long-term Medicaid programs for them, so that their help in the house is actually covered under Medicaid. So that's been good. And we've actually been using it in assisted living facilities, because sometimes it's just the help there is just not enough. And the sisters don't want to go into nursing homes, so we've been able to bring extra help in through the MLTS programs, and then eventually hospice, so that they can die in their homes that they've been in now, some for the last 10 years. We help set up linkage to spiritual direction and retreats. Provide underlinked transportation. Driving, of course, is a big issue for everybody. So we have set up accounts at with cab companies that are in the community, a link to senior buses, Medicaid transportation, and then the coordinators do a lot of our driving as well. Help with meals if they can't get out. We can either take them, pick up food, or so many of the stores deliver now. We have utilized that. Sister Sylvia lives in a building that has a store downstairs, which is great. Not only for, meals if she needs a meal, but just to pick up little odds and ends. We make sure they have medical alert systems. Oh, post-retirement living forms. So we have this group of sisters that live far, far away from us in a bunch of different states. And I'm like, what is going to happen to them when they need help? So last year we started these forms. It was really for them, and then our leadership team loved them so much that the whole congregation had to fill them out. But it asked, are you planning on staying where you are living, or are you going to move back closer to where the supports are? Most of them are staying where they are, but some actually are making the move back. So it was a good prompt to them to really think about things. But for those who are staying, we needed to know, where are you getting help when you need it? Because we will not be able to help you with that. And it just really made them think about who their supports were, who has an extra key to their apartment if something were to happen. So this is kind of a new thing that we've been working on. And it was important for us to know who the sisters' supports are. Who are their friends and who are their family? And really build a relationship with those people as well. We've tried holistic, linking even to holistic interventions, massage, chiropractic, acupuncture. I actually put CBD oil down, and I was afraid to add medical marijuana. However, we live in New Jersey, and it's legal. So we actually, this is very new to us, but I just came back from a conference in California, actually, and it was the hot topic. With the medical marijuana, so. Okay, any questions on that before I turn it over to Sister Sylvia? No. Okay, here you go.
Want to breathe here?
I know, I talk so fast.
The word change keeps coming to my mind. We're experiencing so many changes from day to day, from month to month, and from year to year. And the sisters' presence, have you ever had changes? Remember early in your life when you were having the first change and you didn't ask for it, but you were told where to go and what to do, what school to teach in, what work to do, and you simply said yes, yes, and you went, and you probably had a good time, or not a good time, but a good experience. My first mission was in Camden, New Jersey, teaching kindergarten and the second grade. 8 years later, I was sent back to Newburgh to teach again kindergarten and art classes in all the grades. And then back to Gloucester, New Jersey, where I started work in a high school, where I was to do the yearbook and the staging, and I was scared stiff because I'd never done the staging before nor a yearbook, but we managed to get it done. And then after Gloucester to Passaic, New Jersey, another high school, which did close after I left, but not because of me. Now, various circumstances came along, and I was living in Newburgh, and we had another big change, I call it a very big one, when we had to actually leave our mother house. And you can imagine how not all, but some felt. They were scared, some didn't care. And we learned about the places in Mount Vernon and Connecticut and New Jersey. And the place I chose was, and this time I would choose it, nobody told me where to go. I went to Asbury Tower. And at that time, before I actually went in, we had a bus ride from Newburgh. 19 of us came down on that building, and the people later told me how scared they were. Nuns coming to our building, 19 of us. And it was a miserable, rainy day. Everybody remembers that day. And it was the day we had a nice lunch. And I remember a dog, but people after that said they didn't have a dog, so I don't know what I was saying. And we were able to get a tour around the building and look at the rooms. And it didn't look so great at that time because many of the dumpsters were outside in the hallway. If they were cleaning, renovating one apartment, all the contents of the apartment were in there. So it wasn't so. So what we were impressed by going to the windows and seeing the ocean. And then after that, we were waiting for our phone calls as to when there would be a vacancy for her and for us. And because of the renovations, many people moved out because of the noise, and those remained, had the nice rooms, and there were several vacancies. So I really feel it was God's wonderful timing that that place was ready for all of us. And so I chose, I got the phone call, and I could choose any one room I wanted. I said, just the ocean. So they gave me 7F, 7th floor, and I wish it were the 8th, but the 7th is all right. I just have to sit up a little higher to see the ocean. But really, it's just a block away.
Not even, it's across the street.
No, it's just a dirt street, right, and then us. So it's really great. Everybody likes it. We have a nice outdoor patio in which the people sit and enjoy the fresh air. Most of the people there are afraid of the wind, and if there's a little wind, a little ripple, they stay in their rooms. They're really afraid of the wind. And so God's planning again. It was wonderful. And let me tell you about life there. First of all, it's 26 floors high. Everything is immaculately clean. The hallways are carpeted and wide enough. You don't have to go like this for the next person passing. Although you're probably each time the only one on the floor getting off or getting on the elevator. Not crowded on the hallways. But the elevators, there are 3 elevators, and very often one is having a problem. Can you imagine people waiting outside for the elevator? That's when patience comes in. Some people really think that the president is waiting for them somewhere, and they're really in a hurry. So you just wait. And if somebody grumbles, I just say, well, I'm retired, you know. And I always use that phrase. I don't have to rush anymore. And so some sisters moving to this place were concerned. After all, they were religious sisters, and they had stations to do. They had Mass. They had to have a lot of things that we were always used to. But that matter was taken care of. We were given one of the community room, not community, it was just a small room upstairs to have our Mass. And the priest at that time was a resident, so we had the priest for Mass. And that was just twice a week. The community has made that arrangement and taken care of that financially, so that the priests who come from Holy Angels Church and the St. Philip's Church, one of them. And one priest has come from Washington, D.C. He's a real biblical scholar, and he has Mass on Saturdays, Saturday evening, and that's his volunteering to do that. And people the room accommodates about 26 to 30 people, whereas before the small room, maybe 8. But it's a beautiful service for the people who live there. We have some Protestants coming to the service. And there is also another minister who comes. They have a Jewish section.
Can you talk about the other activities?
Oh, yes.
I'm looking at the time.
Oh, yes. All right. We have a Bible study and meditation group, so there's enough for our spiritual lives. We don't have to worry about that. Now, we get daily mail. The mailboxes are secured. We have a security guard 24 hours a day, and it's very safe. There is a house doctor if he's chosen by some resident, and we have a house bus that would take us. For example, if you had to give up driving like me, the bus will take me to Wegmans or a doctor's appointments, and she holds me up if I fall. And so life is good. Now, I should say it's not all heaven. See, it's very short, though.
It's very short. It is a short.
It's being comfortable with others. We have all kinds of people, wonderful people. And some of them you would not think they were over 62. They're still active. When I first came there, I thought, it's just going to be an old house. No, I don't want to live here. But it wasn't at all. There are many active people and so many activities, so that nobody can complain there's nothing to do. We have a bulletin board which has just been enlarged, listing everything that the residents can do. So no problem to that. And there are gossipers, of course, and I think the non-gossipers recognize the groups and they stay away from them. So the others are smokers, and they go outside, of course. They can't, no smoking or even candles. So you can't even have a candlelight dinner for yourself. Yeah. Oh. And sometimes it's a problem for some people who are lonely. So we try to get them out and communicate. And as soon as they meet some new friends, they come again. But it's always a challenge for us to keep up with them. Now for me, I have so many interests that I'm never bored, and I love rainy days because I like to cook, and I've accumulated several cookbooks. I like sewing, reading magazines, archaeology, and astronomy, although the astronomy I don't understand. And my specialty is calligraphy. So occasionally I'm asked by the resident to make a card for somebody, and it's a personal creative card for them. So life is good, and...
Do you want to talk about how the holistic health team has helped you?
Yes.
Ronnie.
Oh, yes.
What does Ronnie do with you?
Oh, well, if I have to go, well,
Keep it brief.
for the 9 years that I've been there, the arthritis has developed, with age. Every birthday you get another ache here or there. You all understand that, I think. And so Ronnie has been very helpful. There was a time when I couldn't even walk. It was so painful. But thanks to Ronnie and Liz getting me a walker and a cane, and I even have a scooter. But since I've been under chiropractic care, he is marvelous. And now I walk better, and soon I hope to dance at the Halloween party. And so they've been most helpful whenever I need something. And right now I'm hoping to get a real good TV, because I have a real old-fashioned one, one of those little boxes. So now I think I'm going to get a little glass thing that's a little wider. Anything else you want to mention?
Does anyone have any questions for Sister Sylvia? No?
Life is good. God is good.
Good job. Okay, so we're on to our last part because we're over time now. So this part it talks about all of our moving, and I I walked in and I looked in the back of the room where all the paper is and how it's taped with blue tape, Robin. And Ronnie and I are like, no, because we use blue tape when we move the sisters and pack all of their items. And if you walk into a sister's apartment that's in the process of moving, there's blue tape that says dining room, bedroom, sometimes save for Sister Sharon. So, so the blue tape is big with us. But as I highlighted earlier, we move the sisters a lot. It started with the initial move, and they continue to move as they require more assistance or a higher level of care, or sometimes they just like to move. So moving, of course, is a number 3 stressor in a person's life, and that is after death and divorce. And it is very stressful. So at this point, we've done close to 200 moves since we've been doing this. So once a decision is made, willingly or not, hopefully willingly, but sometimes we know there's unforeseen circumstances and we have to just make the move and decision for the sister. And that's when the hard part begins. So Sister Sharon is our transition coordinator. She coordinates all of our moves and then does other things when we're not moving sisters, such as helping with the errands, taking the sisters grocery shopping. Sometimes she even sits in the emergency room with our sisters. And if you do have, if you end up, having to move sisters or make a decision to close your mother house like we did, you need a Sister Sharon in your life. You really do. The next slide, I'll just show you everything, what she does. The process starts with her talking to the sisters about what she may need, what she would like to take with her and what will fit in the apartment. What will fit in the apartment is sometimes not a good conversation. And more things come than really fit in the apartment. Then we're moving them again. She will then draw a floor plan and review it with the sisters. Then she helps pack her belongings, donate other items that are not needed, and disposes of items. She then contacts the mover, shops for other needed items, and is there for the day of the move. And then she unpacks everything that she just packed with the sisters, and makes sure that she is settled in her new home. It all sounds very, structured, and there's definitely steps. But the best part of Sister Sharon's job is the pastoral part of her job. I'm going back to stress, how stressful moving is. So it can be very overwhelming. The sisters need reassurance. They have a lot of questions. And by far, Sister Sharon is probably the most patient person that I know. She will spend however long it takes with the sister. It may take her an hour to pack one box, because as they're packing, they're looking and they're reliving memories, and they're talking about, where sister picked this up in Ireland, on vacation and so forth. So that's definitely the most important part of her job. And she also helps clean out when a sister dies. Of course, all of our team members help, because sometimes it's very overwhelming. One word of advice. If you can convince your sisters to downsize, it'll help you. Sorry about that. I can't even talk, hold on. So, where would you find Sister Sharon? Thank you. If you do have someone, a sister that's still able to, she had a very different background. I mean, she was a phys ed teacher, but then went on, and she's a licensed electrician, and she helps build houses for Habitat, and so she has that other background, and she's very organized. But if you have someone, a sister within your congregation, certainly someone with these characteristics would be important. But there's also a growing field of senior move managers that would be another place to look. And, it's so often, we just did a clean out, unfortunately, of one of our sisters who passed away unexpectedly and lived with an older sister. And it's in a senior apartment building. And all of the other residents were like, wow, we wish we had someone to help us. So, it's very important to do that. So that's pretty much all. I just wanted to touch on that transition coordinator piece. And does anyone have any questions? Yeah.
I just wanted to get your perspective.
Oh, yeah, I'm sorry, I didn't even, I know.
The things that you do. How do you see your role?
I don't really have a role. I think that would be putting me in a box. And we're so fluid, this team. It's absolutely amazing how we all work together. I do the state of New Jersey. So I pack, I unpack, I, get transportation. I am the transportation. You name it, I do it. I mean, there's really nothing I don't do, and I'm not willing to do. I do whatever is asked of me. So if you use this model, which I think is an amazing model that Liz developed, it will help your sisters transition so they're comfortable with me when it's time to let's stop driving. Or I have one sister to bring up real quick. She she continues to drive, but she kind of knows it's coming to the end. So now I get the phone call, Ronnie, I need, can we do this, Ronnie? How about that, Ronnie? So if I make myself really accessible to her, she's going to feel really okay with handing those keys back. So, and I have been with them for a long time, so the comfort level is there. But just being. And they do talk to me a lot, there's no judgment, obviously. And we have so much fun. Oh my gosh, so much fun I have, yes.
What are your hours, Ron? You're full-time?
No, I'm part-time, I'm flexible, I make my schedule according to the sisters' needs. Yeah, and it could be up till 5, 6 o'clock at night, it could be, 6 o'clock in the morning, this one makes me get up, But it's completely flexible, as long as my kids where they need to be, I can do whatever. Thank you. Do I know? Well, Liz lives close enough. Yeah.
I'm the backup.
She's
The backup for all of them.
She is. She's amazing. Yeah. Yeah.
How many sisters are you serving in Jersey?
Well, there are actually some sisters in Caldwell and the New York young lady. She can do them. I really don't know. It's close to 18.
Yeah.
Yeah, I've always run about that because they move in, they move out, they
And
move
that's why our
and
team
move.
is so fluid. They even cross state
State
lines.
lines.
So it's like, Ronnie might have them for 2 years, and then Jennifer might have them, or Sarah might have them, then Ronnie gets them. It's like
It's constant motion.
Yeah.
Thank you.
So I do think that's one of the strengths of the model as it's evolved is Liz didn't go out and hire a whole bunch of staff. I mean, you had Sharon, Anne Marie, and you was how it started. And then added, because Ronnie was kind of started and flexed so that as people's needs changed, you could evolve and flex hours. So that was how the models evolved over all these years, right? Well, Sylvia, thank you for adding like the entertainment of today. I like a whole cadre of new one-liners. And Sharon's role is really amazing. She did work construction and she is so patient. I worked with her on Nuns Build for years. I can remember hanging sheetrock in a FEMA trailer that in just the shower, how the difference between one side and the next, and she kept like, we have to make it perfect.
She's going down next week again, I think.
Yeah, right before. And so, but that team has definitely evolved. And Liz has also been incredibly generous of sharing her resources and story with others. So we are going to adjust a little bit on time. Let's take that, no, don't worry. Take the bio break, and if everybody could be back at 2, that would be great.